Well, hey guys, there is so much research coming out about the role of vitamin D and your immune health, and you've probably heard about it. I know I've talked about it a lot on my channel, and vitamin D is, there's just so much evidence now coming out talking about its preventative role when it comes to COVID-19. Your ability to be infected with COVID-19, your transmissibility, and on top of that, your risk of death or developing pneumonia and getting hospitalized. And so when we look at vitamin D, we know that vitamin D is an immune modulator, meaning that it helps to balance your immune system and allows your immune system to attack pathogens more accurately. And so there's less kind of collateral damage and inflammation that takes place. So vitamin D is extremely critical for a healthy immune response. And we've done now several, very large studies, lots and lots of research. There is randomized control studies, there's observational studies. So we know that vitamin D, we've seen a lot of research with its ability to prevent against respiratory infections. On top of that, it's also very good at helping prevent against the development of neurodegenerative conditions like Alzheimer's, Parkinson's, dementia. It's great at preventing against heart disease, high blood pressure, insulin resistance, a lot of these comorbidities that are associated with bad COVID-19 outcomes. We know that vitamin D plays a critical role in preventing those. And so when we look at some of the big studies that have been done, looking at all the different observational studies, the randomized control studies, and kind of taking all the data and putting them together, they call it a meta-analysis. And so there was one that was done that was published in the Journal of Frontiers in Public Health, and that was done. And what they found was that they actually found that people with vitamin D deficiency had an 80% greater likelihood of developing COVID-19, so getting the infection, than people who weren't. And so 80% is huge. That's a really, really big number. So, you put that in perspective. So if we had 10 people that were vitamin D deficient, and we got them all to a sufficient level, then only 2 of those people, if all 10 were going to get the infection, now only 2 would get the infection. So, that's a significant reduction right there. And, it shows you that vitamin D is just so critical for your overall immune health. And then there was a recent study here now that came out at the end of August 2021, and it showed that people with a vitamin D deficiency were 60% more likely to die of COVID-19 than somebody who was not. And on top of that, they were 50% more likely to develop severe pneumonia, be hospitalized for very long periods of time. We've also seen that having a vitamin D deficiency also sets you up for what's called long hauler syndrome, or when you get COVID-19, you have a bad outcome, you recover, supposedly recover, but you just never really recover. So you might not be in the hospital, but you're feeling out of breath. You're feeling really, really fatigued. You have brain fog. You have more inflammation in your body. You're feeling more pain and soreness, and you're not yourself. And that is what we call long haul syndrome, and vitamin D deficiency is very much associated with that. Now, when it comes to vitamin D, so critical that we optimize this. And of course, the best way to get vitamin D is getting daily sun exposure. So I recommend 20 to 40 minutes of sun exposure, depending on your skin type. So if you're very, very pale, if you're like Scandinavian, you might only need 15, 20 minutes of good quality sun exposure. You want to get it on as much of your body as possible. So, ideally around 40% of your body to really optimize the amount you're absorbing from the sun. So think about it like laying out in your bathing suit, okay? That's really kind of the amount that you need. So if you just go out and get your face and your hands, some sunshine there, you're gonna get a little bit of vitamin D, but not enough to really move the needle for you. So you really want to be, in a sense, sunbathing. So again, if you're very pale, 15, 20 minutes. If you're very dark, 40 minutes, 50 minutes, might even need 60 minutes. We don't really know, but that's why I just have kind of the general recommendation of somewhere around 20 to 40 minutes to really optimize your vitamin D. Now, how many of us are able to do that? Probably not too many are able to get sun like that on a regular basis. And so that's why vitamin D supplementation can be so helpful. Also eating vitamin D rich foods. Now, vitamin D rich foods do not have a whole lot of vitamin D. They're very, very low levels, but they'll still help move you in the right direction. So that's going to be things like pasture-raised eggs, pasture-raised butter. So when an animal is grass-fed, it's going to actually have higher vitamin D levels than a grain-fed animal's dairy products or meat products. So that's why we're saying pasture-raised eggs, pasture-raised, particularly the yolk of the eggs, pasture-raised butter, grass-fed butter, liver, so any sort of organ meats, also a really good source. And then from a vegetable source, mushrooms are really the best source. But again, not very good sources overall, so not something you can really rely on unless you're doing a lot of liver, unless you're eating a lot of grass-fed liver. And so this is why we like supplementing with vitamin D. And so what I recommend is supplementing with about 1,000 international units of vitamin D3 per 25 pounds of body weight. So if you weigh 200 pounds, you're roughly looking at about 8,000 international units a day that you want to be supplementing with to kind of get you where you need to be. So we can always round up or down a little bit. So, for somebody that's 200 pounds, I might round up to 10,000 international units a day to really kind of get their levels where they should be. Ideally, your vitamin D levels should be roughly between 50 to 100 nanograms per milliliter. Now, what's considered deficient is less than 30 nanograms per milliliter, less than 30. But for really optimal health, we want that up over 50 nanograms per milliliter. And really for best prevention against any sort of viral infection, a sweet spot is going to be somewhere around 70, 80, 90, somewhere in that range, getting those vitamin D levels up high. And there are other doctors out there that actually have their patients getting up in the 120, 130 range and seeing good results with it. But we don't have long-term safety studies to know for sure if that is a healthy vitamin D range. And so what's considered a toxic level of vitamin D at this point is over 100 nanograms per milliliter. However, many clinicians that are working with people getting their levels up really, really high have said that they are not seeing any sort of toxicity symptoms until somebody's up like over 200 nanograms per milliliter. So getting up over there may be safe. Again, we don't have the long-term safety studies to know for sure, but right now, out of caution, we're saying 50 to 100 nanograms per milliliter. This should be all over the media, everywhere. They should be talking about this. The studies are very conclusive, saying yes, vitamin D deficiency is one of the greatest risk factors. And I would add in something like insulin resistance, which those two go hand in hand. When you're insulin resistant, you actually need more vitamin D to get your vitamin D levels up. And when you're vitamin D deficient, you become more insulin resistant. And that means your body doesn't respond to insulin. It doesn't regulate blood sugar very well. And it drives up inflammation and also drives fat gain as well when you're insulin resistant. So very important that you're exercising, sleeping right, eating right, to keep your insulin levels sensitive. But then also on top of that, taking the right amount of vitamin D. Now, if you know you are vitamin D deficient, and the way that you would know is, number one, you would get a lab test, a 25 hydroxy vitamin D test, and you would be less than 30 nanograms per milliliter. That would be one way to know you're deficient. Another way would be if you're frequently getting sick, right? Colds, fevers, flus, things like that. If you've never supplemented with vitamin D and you don't regularly sunbathe, right? At least like once or twice a week where you're literally sunbathing in your bathing suit, you're most likely vitamin D deficient. So that's another way to know. So if you are deficient, it's a good idea to take somewhere around 2,000 international units per 25 pounds of body weight for like a month or two to get your levels up, especially if you are listening to this and starting to take action in the wintertime when you're not getting much sun anyways. And so we know that vitamin D levels for most individuals tend to be at the highest kind of right at the end of the summer. And then they tend to be at the lowest in like the early spring because your body's using up the vitamin D all throughout the wintertime. So you want to actually store that up. Now, we also know that if you get a respiratory infection like COVID-19 or the flu or anything like that, it will actually deplete your vitamin D levels. So you also want more if you have some sort of symptomatic infection. So that's a good idea to take 2,000 international units per 25 pounds of body weight during that period of time as well. Or for some individuals, I'll have them take 20,000 international units during that period of time. And we'll split it up, take it in, like 2 servings, like 10,000 international units in 2 servings. Now, vitamin D is always best taken with food because it's a fat-soluble vitamin. So you absorb it best when you take it with food. On top of that, vitamin D, in order to absorb it and convert it into the active form of vitamin D at the cell, we also need other cofactors. We need vitamin A, for example. We need enough vitamin A. And that's why in nature, when you look at foods like grass-fed butter, there's a lot of vitamin A in there, as well as vitamin D. So they come together. Vitamin E as well, and vitamin K2, that's in the butter. So you have all your fat-soluble nutrients. In your liver, you have all your fat-soluble nutrients. In your egg yolk, all your fat-soluble nutrients are right in there. So make sure you're consuming those foods so you get enough vitamin A, vitamin E, vitamin K2. And I recommend when you're supplementing with D, you take it with a vitamin K2 as well, because vitamin K2 is harder to get from your diet. And vitamin D and vitamin K2 work together to clean calcium out of your blood vessels. Now, why is that important? Because when calcium is not, when we have too much calcium in our blood and we're not able to get it into the bones where it belongs and into the different cells, then we can end up with joint degeneration, with arterial calcification, right? We don't want these calcifications in our body. That actually ages us and degenerates us. And so vitamin K2 is really important for that process. Now, we also need magnesium. Magnesium is critical for overall vitamin D conversion into the active form of vitamin D at the cell, where it can act on the vitamin D receptors. And so taking some sort of good quality magnesium, and also, again, all your good food sources of vitamin D are also good sources of magnesium, your grass-fed butter and eggs and things like that. And also green leafy vegetables can be a great source of magnesium as well, so you can consume those. And even things like dark chocolate can be a good source of magnesium. And you may want to supplement with that as well. One way to know that if you're not getting enough magnesium, you might have anxiety, you might have muscle cramps, you might feel tight and rigid. And if you've had a respiratory infection recently, you most likely depleted a lot of magnesium. It's one of the most common deficiencies out there is magnesium deficiency. So a good idea to supplement with that as well. And then also zinc is really important. Zinc helps activate the vitamin D receptor. So the VDR receptor is activated by zinc. So if you're zinc deficient, you're not going to have enough of these VDR receptors, and you're not going to get the desired function of vitamin D at the cell. And so we also know that zinc is very important for preventing against viral replication in the body. So zinc plays a number of different roles, and zinc is also a common deficiency. So where do we get zinc? We get zinc from seafood. Wild-caught seafood is a great source. Also grass-fed meats, so our really good quality animal products. The best vegetarian source of zinc is pumpkin seeds. And if you're going to consume pumpkin seeds, I would recommend consuming sprouted pumpkin seeds, which remove some of the anti-nutrients, some of the phytic acids, which actually bind to zinc and inhibit absorption. So you want to remove those. So sprouted pumpkin seeds would be your best vegetarian source. Other than that, consume lots of good quality grass-fed organic meats. And consider supplementing with zinc. It's one of the best things, again, for helping inhibit viral replication. It's also really important for testosterone, for progesterone production. It's very important for good skin. It helps reduce inflammation in the body, helps promote really healthy, youthful skin as well. So I recommend taking somewhere around 20 to 30 milligrams of zinc daily. And that's another one you want to take with food. Really, all of these things I've talked about. Magnesium is okay without food, but the other ones, vitamin A, vitamin D, vitamin K2, and zinc, all best taken with food. So hopefully, guys, this has been helpful. We talked about some of the best food sources of these nutrients, how critical vitamin D is, the different fat-soluble nutrients like vitamin A, vitamin K2, and even vitamin E that play a role in vitamin D metabolism and utilization in the body. And we also talked about the importance of magnesium and zinc in that process as well. So guys, check out the links below this video. I've got a link to an article on vitamin D resistance. This is a condition where people, they try to supplement with vitamin D and try to get in the sun, but their vitamin D levels stay low. There's things you can do if you have vitamin D resistance. So check out that article. And also I've got links to the different studies that I talked about here as well, and a link to a detailed article on vitamin D deficiency that you can read as well. So check that out. If you haven't subscribed to our channel, Now is the time to do that, and hit the bell button. That way you get notified whenever I put up a new video so you never miss one of these important trainings. Thanks so much, and we'll see you guys in a future video. Be blessed.